Nationwide, parents are struggling to find common over-the-counter medications as flu, COVID, and RSV cases continue to rise. We spoke to one local pharmacist who says he's seeing a shortage of common fever reducers and children's Tylenol and ibuprofen.
Our Peter Choi explains why parents should not resort to adult-strength over-the-counter medications without talking to a pediatrician first.
The nationwide shortage of children's medication is adding extra stress for parents this holiday season. And some parents are using adult-strength over-the-counter meds like ibuprofen and Tylenol. But one local pediatrician warns it can be risky.
Very challenging. I mean, it's just a lot more steps in terms of making sure they're getting what they need.
The circulation of 3 respiratory viruses, RSV, flu, and COVID, is swamping this local pediatric clinic on South Hill while facing a medication shortage because of supply chain issues.
We're primarily seeing shortages in our mainstream antibiotics, so we're having to call pharmacies ahead of time to see if they have amoxicillin, which is our go-to medication in pediatrics.
The nurse practitioner says don't try to replace children's medications with adult medications, as using them for children could be dangerous.
They're all weight-based, so you have to be very careful to know your child's weight to give them the appropriate dose, and then to make sure you're giving it at the appropriate intervals so you're not overdosing any children.
The health expert recommends calling your pediatrician first to get the best advice specific to your child. Aspirin is the one medication you absolutely want to avoid giving to your kids.
If they take aspirin, there's a risk of getting a secondary problem that affects the brain and causes inflammation.
The nurse practitioner recommends kids to wash their hands often, stay at home when they're sick, and mask up when needed. And plus,
going to an ER for a mild illness is going to expose you potentially to a lot of more severe illnesses.
In Spokane, Peter Choi, 4 News Now.